A very good morning once again, and thank you for waking up to Sunrise at Sea here on CTV, and welcome to our Wellness, Beauty and Lifestyle segment. And today we are talking diagnostic radiology. Now, if you do not know what that is, this refers to the field of medicine that uses non-invasive imaging scans to diagnose a patient. The tests and equipment used sometimes involve low doses of radiation to create highly detailed images of an area. But since I'm not expert in this medical field, today I am joined by Dr. Tugume Innocent from Kampala Hospital, and he is also the head of radiology in Kampala Hospital. Good morning, Dr. Innocent.
Morning.
Thank you for joining us on Sunrise at Sea.
Thank you for having me here. Yes.
Well, I would like you to expand on this matter of diagnostic radiology.
Yes. Thank you so much for having me. Where do I start? Diagnostic radiology is one of the field of medicine that has been very effective in helping the clinicians or the physicians diagnose problems that patients have. There's been involvement of so many machines that have been helping fields from, let's say, from cancer to simple things like obstetrics for mothers and pregnancy. It has come at a point where it sort of like has eliminated this field of guesswork of what could be the problem with this patient. We now use diagnostic radiology to identify what the problem is with the patient,
yes,
and then get the right treatment to them. Yes.
Okay, what is the importance of diagnostic radiology in medical treatment?
Oh, okay. That's a good question. Currently, as we stand, it's no longer, you cannot treat anybody without doing some sort of a radiology investigation.
Yes,
our problems or what we are facing has evolved. So with this diagnostic equipment, it's become apparent that any doctor who's going to help you or find out what the problem is you have may have to use a diagnostic equipment of any form,
yes,
to help diagnose and better treat you. So it is actually very crucial.
Very fundamental.
Yes, very fundamental.
And when it comes to this equipment, of course, for the little knowledge that I have with medicine,
yes.
There is people who are, probably they could be allergic to some equipment, that could maybe get reaction due to some equipment. So how do you go about that?
Okay, so maybe I would break down exactly some of the equipments that we use and what sort of technique they are built in. I would say we'll start with, we have what we call radiation emitting equipments. Those would be the X-rays equipment, and we have also what we call radiotherapy. Now, X-ray equipments are these, I think most people have heard of X-rays. They use what we call X-ray radiation. And this X-ray radiation is exposed to you, and that creates an image that the doctor reads. Say, for example, I could give an example of someone who's broken a bone.
Yes.
When you break a bone, if it's not visible out on the skin, you go do an X-ray, and that picture, the doctor or orthopedic officer will use that to know how your bone is broken and then plan on how to fix your bone. So that uses radiation.
Yes.
That's just the X-ray element of it. We have equipments like MRI. MRI uses a magnet. It's a high-powered magnet. And these magnets create images that, at the end of the day, the doctors also use to study and see how to help you. So for it uses what we call magnetism. It doesn't use radiation.
Yes.
Then we have ultrasound equipment, which are the commonest, I think up to even the lowest of the village. And these ones are usually used in obstetrics, mothers, and also finding out what could be wrong in your organs. It's like having a visual camera that sees your organs without actually having to operate you. Like you said, it's non-invasive.
Yes.
So these equipments, in general, apart from the X-ray, the MRI, which is magnetic, ultrasound uses sound. So ultrasound is considered safe for everybody. So anyone can do it. It uses
At
sound
any time.
at any time.
Like you don't have to be sick, because there's this mentality of you only have to go do an MRI, or you have to do an ultrasound when you have
ultrasound is free. You could do it at any time. The purpose of it doing it's actually very influential in routine medical checkups, which is not a practice that we do here, but it's quite safe. And so everywhere you go and you feel like you need to do an ultrasound, you're free to go in and request for it. So for X-ray and MRI, you need to have a physician or a doctor request for those specific exams. One, because X-ray uses radiation. So before we allow you to do an X-ray, we need to make sure that it benefits you, or the risk of radiation, because radiation usually predisposes patients to cancer if they use it over time. So we always have to first weigh whether it is beneficial to you before we allow you to go in. So you need to first seek advice from the doctor, and he sees whether your condition requires us to do the X-ray. Same as MRI. MRI is a little bit advanced because it comes at a point where they've done the X-ray, they've done probably a CT on you, and they feel like they need to go a little step further. That's when you go for MRI. Yes. So actually, X-ray and CT, those are the two equipments that use radiation.
Okay.
Then there's something I talked about called radiotherapy. Radiotherapy also uses what we call gamma rays. They are also radiation emitting, they are radiation sources. So they also predispose patients to cancer, but radiotherapy is a treatment for cancer. It kills cancer cells. So that one is also part of the field of radiology.
Okay, now in the recent past, I read a story on social media where a young child was affected. I think it was an ultrasound or an MRI. I'm not so sure about that. But my question here is it the same equipment that is used on elderly people or people like us who are 18 and above? Are they the same equipment that are used on kids, or it's different?
No, it's the same equipment, but within the equipment itself, they put in settings that are pediatric. They're supposed to take care of children, and then there are parameters that are supposed to be for adults. So it's just like how you choose a shirt that is the size of a child, and then a shirt that is adult. So when we are working on a child, there are some preset protocols that we choose that we know will lower the doses of radiation to the child and not be at the same level as when we're working on an adult.
Yes, and also getting back to this whole equipment of radiology, there is a notion that, it does have, they do have their impacts and negative impacts. It's not just positive. It's medicine, and it's a good thing, but they do have their negative impacts. So we'd like to know those negative impacts of this equipment and the radiology, MRI, and how can people go about them?
Okay, so still going to break them down. Ultrasound, like I said, is safe for everybody, so it's quite a safe diagnostic equipment tool that we use. So X-ray, like I said, always predisposes people to risks of cancer. So while we're using it, we use it in a regulated form. Now, the risk, of course, there is if you, say, for example, you come in, like we don't work on pregnant people or early pregnancy, because we know if we expose you to X-ray, there's a chance that the cells of the growing baby could mutate and your child comes out with an abnormality. So we always take precaution towards that. So X-ray can expose you to mutation or can expose you to cancer. So it's kind of regulated. With MRI, if you have any metal on you, like for example, you have, they put in an orthopedic hardware, let me say like they call it a metal, in your skin after you're broken, you're not allowed to go in MRI because it's a magnet, so it will pull out that metal. If you have a pacemaker in your heart, these people, you can't go for MRI. So anything related metallic, you might not be able to access an MRI. So we control it because of the magnet element. So X-ray, that's the high risk that you get the radiation, and MRI if you have any metal could have that problem to answer.
Okay, and finally, for my last question, I'm very, I've been told before to go for an X-ray, and I turned it down because of all this mystery surrounding it and the stories that we get to hear from people. So maybe there is someone out there who's just like me, scared of X-rays, scared of anything, MRI or radiology, all those equipment. They actually come with a lot of, when you talk of radiology, when you talk of MRI, it's scary a little bit. Well, at least for me. And I know there could be someone out there who thinks the same as me. So what reassurance or assurance do you have for someone out there who is scared of, you know, taking these tests or examinations?
Well, I can give you an assurance that these equipments are, well, I can say they are certainly safe if you go through the right channels, if you talk to the doctors and they see that you actually benefit from this specific study. The teams that are around, or the people that actually operate them, are professional enough to know what kind of dosage or what kind of plan they should use that is actually safe for you, and at the end of the day will give you the benefit of results. So I urge everyone out there that if the doctor actually did request you to do this exam, it's probably beneficial to you, and you shouldn't worry at all that it's going to have any side effects towards you. That's
okay, and yes, on this same matter, is it okay for someone to just wake up and go and do those tests without having to be recommended by a doctor? There's people who are very keen about their health and would love to, you know, just go and be aware of what is going on in their bodies before it could get worse.
I would say yes and no. The yes part is you could just be, there are people who are health conscious and might go and do an exam that is not beneficial towards what the problem is. So we still insist that it's better you do some small consultation with a clinician so that they pick out exactly what kind of exam would be beneficial to you. These diagnostic equipments have multiple exams, so you might go there and just do an exam that might not give you the answer you're looking for. So we still.
Or maybe you could get a wrong answer. Is that possible?
To get a wrong answer?
Yes.
Just doing maybe the wrong exam. Because it might not give you the exact answer that you want, but it could be a wrong exam, and you end up repeating, you end up spending so much money. So it's always better to first go and see whether this exam is actually beneficial to you, and then then after you do the exam.
Well, you heard it from the expert, and that is Dr. Tugume Innocent from Kampala Hospital. Thank you for joining us once again on our Wellness, Beauty and Lifestyle this morning. Yes, thanks for joining us again on Sunrise at Sea, but do not go anywhere, because coming up is a Twitter Jab Stew with Sandra, rather with Shivan Omar.